Colleagues, I'd like to begin by recognising that this time of intense pressure on our network, in particular last weekend that you've just been through. Can I thank you for everything that you've done and are doing to provide care for the people of Scotland in the face of the COVID-19 outbreak. And as always, I'm proud of what you're doing and I'm sure what you will do. I know this is a worrying time for you as individuals and for the wider population at large. It's an overwhelming amount of information at the minute, and if you don't mind me saying, an equal part of misinformation, and it's all flying around. This must be incredibly difficult to navigate your way through, and given that little of that is specific to community pharmacy. We encourage teams to refer to our website that links through to Health Protection Scotland's to give you the most up-to-date clinical advice. We recognise that at CPS there's a gap between that clinical advice and the operational stuff because we are seeing and hearing your concerns loud and clear. This past few days we've been hard at work, admittedly behind the scenes, trying to get you answers for those things. This morning, therefore, we had a productive meeting with our Scottish Government colleagues, and I'd like to share with you some of those practical actions we have taken, as well as some actions you yourselves may wish to consider. We don't have all the answers or all the detail for you as yet, and this is a very fluid situation, so please, what I say to you this afternoon may no longer be the case in a few days' time or even tomorrow. But before I talk you through some of that detail, I'd like to spend a little time talking about permission. Because understandably, for a profession that's so highly regulated, something that we have noted is that many of the questions we're getting from pharmacy owners and superintendents start with, can we? For most of these questions, the answer will almost certainly have to come from within your own organisation. It is unlikely that there's going to be blanket advice to, for example, establish a 2-metre barrier between you and any patient, or to stop deliveries, or to only see people at the doorstep. And no one else working in healthcare has been issued with government advice to that effect, because the evidence or science behind it as yet is not there to support that. But you can do all or any of these things if you feel it necessary to keep your pharmacy running and keep your patients and your staff safe. Our team, we're here to make sure you've got a good sounding board or to help you through any legal, professional or contractual implications, that we will put out some further points for pharmacy owners and superintendents to consider as that situation develops. The permission to act, though, is yours to give, and once you have identified and please assessed any risks that you consider appropriate. What we at CPS can do is to work on what is within our control to remove any additional unnecessary, as some might call it, nonsense or background noise that might distract you from dealing with the considerable task you've got at hand. And that was precisely the purpose that we had with our government colleagues meeting this morning. And I'll try now and summarise that for you. The first thing, and it's the thing that we are most often asked about currently, is about personal protective equipment. Now, this has been supplied to healthcare workers in some other settings, not them all, and to community pharmacies, I'm aware, in other UK home countries. Now, following a Scottish Government review of the evidence and the science behind that, the policy decision at this time is not to supply these kits to community pharmacies in Scotland. Now, I know that decision will concern many of you, particularly those of you working on the front line and at this time, and I can completely understand why, when everyone else, or appears to be everyone else, is getting that you feel left out. What I can say is that I have put my trust in the experts advising our colleagues at the Scottish Government and accept their decision. Wear PPE or personal protection equipment as effective as social distancing. I, for one, would ensure that you had it, or at least do my best to make sure you get it. Can I turn now to finance? Please don't worry about this. You can be confident that the income for the pharmacy will be protected to support your continued service delivery. and no pharmacy will be disadvantaged for events that is out with their control. As we finalise the detail behind this, it will be published, but please rest assured the government is supportive of the network's crucial contribution throughout this time. Can I move on and say a word now about services? To support pharmacy teams to deal only with what is necessary at this time, we have agreed to freeze CMS registration activity immediately and have asked the government to look at how to completely separate serial prescribing to attempt to minimise the repeat dispensing burden and the management that places on you and your teams. You may also wish to consider whether to suspend any other services other than dispensing and the current minor ailment service, depending on your particular circumstances. In mentioning dispensing, we are aware that in some isolated areas, repeat dispensing quantities have increased quite significantly, which doesn't help you in your efforts to make sure everyone has enough medication. So just today, we have also heard that in one area, established repeat prescribing ordering systems have been shut down, resulting in yet more traffic to you and your pharmacies in the surrounding areas. Scottish Government are therefore going to be stepping up the communications to make it clear that these actions are not in line with policy, and they are supportive of community pharmacies managing these prescriptions using the endorsing tools available to you. For example, only providing medicines to cover a normal cycle of prescriptions. So if that's 28 days or 56 days, you would be free to supply that. And I ask you to consider doing so to ensure we continue a continuous supply through to the network and our patients. On the other hand, it's safe to say that we are all in support of you using the Unscheduled Care Patient Group Direction to its fullest to support patient care where needed. Government colleagues recognise that, and the access to the emergency care summary would assist you to do so, and are working hard to make this happen. Another small thing we can take away straight away is patients signing prescriptions. This can be stopped. It's one last contact point, and it stops pen being passed from person to person. In terms of stock, we are aware of the issues around some lines and can assure you that these concerns have been escalated to the colleagues at the Department of Health. We are also aware that to keep people at home, if they are suffering symptoms or self-isolating, it's going to require prescription-only medicine quantities of paracetamol to be supplied. And we're working with the Area Drugs and Therapeutic Collaborative to get this patient group direction or something like that produced for you to allow you to use that. Something to think about in terms of instalments. You will need to take a risk-based approach to your decision on how to proceed with prescriptions which are normally issued daily or weekly. We would support the General Pharmaceutical Council's statement on flexible regulation and echo their call for you to document the decisions you make. For MDS, this could result in 4 weeks being issued at one time. Supervision of daily medicines. Some medicines require close interaction with patients. Some of you may be able to adjust your procedures to eliminate or minimise patient contact to keep your team's risk of infection low. For those who do not, you will have to make calls on an individual patient basis, taking into account the level of risk involved and involving any other healthcare professional or team that might be able to assist with your decision. You may have to suspend daily supervision once all risks are considered. In terms of deliveries, health and safety of your team must come first. If you are able to continue to offer this service by adjusting your standard operating procedures, for example, ringing the bell, leaving the medicine on the doorstep, retreating 2 metres and waiting to see the patient collect the medicine, then you can please do so. We have asked Scottish Government for financial support at this time to recognise the critical nature of the service and the increased demand you will be experiencing for deliveries. More information will be provided when a decision is made on this, and you'll be the first to know. I mentioned now about the redeployment of pharmacy workforce. All areas of the NHS are currently under strain, and moving people to where they are needed most is a complex task, and patient safety must come first. Health boards will carry the responsibility for that, and discussions have already started across the country about redeployment of staff. All potential outcomes are being considered at this point. We will shortly release a briefing reiterating everything I've just covered this afternoon, which will outline some further detail that pharmacy owners and superintendents may find useful. So please, can I ask you, keep an eye on our website. That will link you through to Health Protection Scotland's for any further updates as it changes on a daily basis. But until then, can I wish you all the best to you and your teams for everything that you're doing and keeping the nation safe. Thank you very much.